Great, thank you everybody. There'll be Slido questions coming up behind me, so do feel free to pose questions to the Shadow Home Secretary, Health Secretary.
Now, I definitely don't want that job.
No. So Wes, we have a couple of commonalities that I should share with you before anything else. You're born in Stepney, is that right?
Yep.
So I work at Royal London Hospital for the last 20 years in Tower Hamlets. Yep. More importantly, I was raised in Ilford. So two Ilford boys sitting here talking about the future of healthcare, which I think is quite apt.
That's not bad for our part of London.
Not really, bad for London, compared to West London, of course,
yeah,
right?
Finally bringing down the Islington Mafia that controls our country.
Of course. So a few things. I want to take it back before we talk about technology. You mentioned at the beginning of your talk earlier around the current challenge we're facing in the NHS. I've been a surgeon for 31 years now, and I've seen a lot of changes take place. And I feel that currently we all feel that the NHS is broken, it's fragmented, and it's a different place to be for healthcare professionals. Some of the data around that. We have 8 million people waiting on the waiting list for surgical procedures or diagnostics. We have 125,000 vacancies across the NHS. That's 10% of the entire workforce of the NHS. 43,000 nurses vacancies and 10,000 doctors. We're also not doing well in cancer outcomes. We're lagging behind a lot of Europe. And of course, we've had the strikes on and off for the last 18 months.
Now you said all that, I wouldn't mind being Shadow Home Secretary.
But the question is, in 9 months' time, in November, Labour will probably get elected and you'll probably be the Health Secretary. So how do you face those challenges, first of all? They're like the basic level that we're struggling with. Tech is amazing, and we'll talk about it in a moment. But that's what we're facing at the moment. How do we overcome some of that to replace the trust that's been largely destroyed in the NHS?
Yeah, I think that's a very, very good question because, especially in terms of political discussion and reporting, we kind of dive straight into those what I kind of call immediate burning deck issues of the backlogs, the strikes, the vacancies, and the challenge of an incoming Labour government, which would be far greater than it was in 1997, has got to be to do two things simultaneously, which is to grip the immediate crisis in front of us, but also to help the system to lift its head to the horizon and think long term. It's been so short-termist, and understandably so when we've had, in the just over 2 years I've been the Shadow Health and Social Care Secretary, I've been up against 5 health secretaries. And that turnover of personnel, whether any of them were any good or not, you know, you cannot, I mean, it's the conversation I've had with Keir Starmer. If you're serious about a 10-year plan and decade of national renewal, you do need stability, certainty, continuity of personnel, and consistency in policy. And in terms of how people are feeling in the NHS, I mean, there's this enormous moral injury that people are suffering, which I think over and above everything else is why retention is so poor, because people go to work, slog their guts out, do their best for patients, and they really do, with a few exceptions, they really do care about their patients. And when you slog your guts out and you go home with the anxiety in your head, did I do everything I needed to do on my round today? Did I miss something? The person in Bay 4, I don't think she got the care she deserved. Someone died today. Did I do everything I could? That's a heavy burden for altruistic, ethical people with good convictions and a commitment to patients. It's a huge burden to carry. And so I think that one of the things we've been discussing in terms of the 10-year plan is how do we make sure we're moving at pace and with urgency, but also mobilise the system around that plan, because I want everyone who works in the NHS to feel like it's their plan, as they did actually with the last Labour government and the 10-year plan that we did. It's striking when I talk to people around the NHS at the time, they don't even refer to it as Labour's plan, they talk about it as our plan. There was a genuine sense of kind of team effort and spirit, and that's what we've got to rebuild. So yes, there'll be policies in our manifesto that both kind of tackle the immediate crisis, provide voters with some confidence that we've got credible policies that are both funded and credible, able to be delivered, which hopefully motivate them to go out and vote Labour, because we don't take that for granted. But also, if you think about some of the things we've announced, 2 million more appointments a year at evenings and weekends to cut the backlog, funded by £1.1 billion worth of investment, doubling the number of CT and MRI scanners, mental health hubs in every community, mental health support in every school. I could go on and on. Individually, they'll all make a difference. Taken together, they're not the panacea, but they are the serious foundation for a decade of national renewal. And in each of them, we're offering proof points about the thrust of our reform policy and what we want to achieve, which is really three things: a shift in the centre of gravity in the NHS out of hospital into the community, better primary care, community services, social care. Because when I look at other OECD countries, we run pretty much top of the table for spending in hospitals. But in all of those other areas that I've just mentioned, as well as diagnostics, capital, we're either near the bottom, at the bottom, or seriously lagging behind. And as a result, we end up with this bizarre situation where, because people can't get a GP appointment, which costs 40 quid, they end up in A&E, which costs 400 quid. Worse for them, more expensive for the taxpayer. Because we diagnose cancer late, we don't get to them in time, not only can there be fatal outcomes, but the journey that patients go through is far more tortuous and far more expensive. There is a nice alignment between value for taxpayers' money and value for patients that a reform agenda has to underpin. And it's the lesson for me of the last Labour government is investment matters, of course it does, but unless it's married with reform, you end up with the spectacle of a Prime Minister being interviewed by Piers Morgan when confronted with the worst crisis in the NHS, says, as if it's an achievement, oh, but we've never spent more on it. Like, oh, right, so we're spending a hell of a lot of money on a really poor service. It's not an achievement, that's an indictment.
Let's bring it back to bit tech that you mentioned quite well in your kind of speech. You mentioned the NHS app. Now, of course, you mentioned 31 million people access the app or have access to the app on their smartphone. What's preventing us from using it more widely at the moment, do you think? Because obviously when I go around the world, and I also show the app, I get mixed reaction. They quite like the app. They say, hey, you've got the app nationally. People are quite impressed, but the functionality, of course, could be improved. What are your thoughts around that? What could we use it for?
Look, I think that there are a couple of obstacles. One is fragmentation, and I'm constantly with my team, and I think this will be a point of kind of regular conversation with the system if we win the election. How do you get the balance right between recognising that if you're going to have a serious innovation culture that changes the lives of patients and improves the NHS, that's not coming from one person sat behind one desk in Whitehall. That's going to come from brilliant people who are working on the front line, and we've got to give them more freedom, more autonomy, because some of the best stuff I've seen in the NHS has been consultant-led with multidisciplinary teams that are doing some really, really exciting stuff, which gives me the hope and confidence that we can turn this ship around. And yet, we've got a very fragmented system where lots of the advantages of a single-payer system in the NHS is not realised. So how do we get that balance right between accruing the central benefits of central procurement, central innovation, economies of scale, value for money, at the same time as allowing people to innovate? And so I think part of the NHS app's
so what services would you like to see on the app?
Some of them I mentioned in the speech, but really simple things, being able to book appointments, manage appointments online. Some people can do it now, and always kind of point proudly to it when they do, but many of us can't. And being able to book a GP appointment on your phone shouldn't be the exception; it should be the ordinary. Managing your patient journey, managing your appointments, receiving. I mean, especially as we start to marry genomics with big data and do predictive medicine, in the not too distant future, we won't have standardised ages for screening. We'll have personalised ones, and you'll be getting that. Getting push notifications on your phone. If you're on a treatment pathway and a new clinical trial's opened up, you won't have to Google hunting around for it or hoping that your consultant has noticed and can have a word and get you onto it. You'll receive a notification, the opportunity will come up. I think there's loads of potential in the app, it's just not being realised. And that brings me on to just the second, cultural problem. I was talking to someone recently involved in the NHS app, and he was telling me that part of the NHS's reticence was that lots of people online, particularly in the age of vaccine hesitancy, are very nervous about the app. And I asked what the evidence was, and he said social media notifications. I mean, if I paid attention to my Twitter mentions, I wouldn't get out of bed in the morning. I sort of see this kind of like surreal kind of image of what people say I want to do to the NHS. Apparently, I want to privatise it. In fact, I've actually said I want to privatise the NHS over my dead body, and I think some people are quite attracted to that idea. The latter bit, not the former bit.
Coming to that point,
I think we've got to take this. We've got to take this stuff on. That's social media is skewing our national conversation, It's amplifying kind of quite polar extremes in every aspect of national debate, and we've got to cut through it, and we've also got to reintroduce the art of nuance into our society and our discourse, that not everything is black and white. There are lots of shades of grey, there are choices and trade-offs, but I think most people in this country want the NHS to be able to access their data across a range of services and see their whole health record and their whole picture as a patient, as a person. And I think people do trust the NHS with their data. They might not trust government with their data, and the good news is government's too incompetent to use it in the way that they fear. But the NHS could use it in a much more intelligent way, and we've got to take on the crackpots.
So data is another big conversation, I guess, for another day. We'll talk for hours about how data might be managed going forward. The other thing that often comes to mind is around the private-public partnership that I think you've raised a couple of times before. At the moment, a lot of NHS work goes to the private sector because of capacity.
Yep.
We understand that. But also, we have industry partners here amongst us here today wanting to come to the NHS, great ideas, for example, to disseminate, to scale it across the NHS. But fundamentally, it's been quite difficult and a challenge because of bureaucracy, the barriers we've put in place. How do you overcome some of the barriers around great ideas from out there, from the startups we have to date, industry partners that might come in? How do you create a better conversation so they can come into the system?
I mean, that's where political leadership, I think, is really important. We should have a single front door into the NHS. We should realise the benefits of a single payer system and end the absurdity of people having to go from trust to trust to trust to trust to trust, as if somehow they're doing us a favour rather than, or we're doing them a favour, by letting them in rather than, they're able to offer enormous change. We've got to kind of deal with the absurd culture we have in this country, which I call the sort of start-up take-off culture, where brilliant people in this city and right across the country are coming up with brilliant new innovations, whether treatments, technology, systems. They prove their concept here, but then when it comes to scaling up, they've started up and then they take off to another country, because countries like America or other European countries, Southeast Asian countries, they're so much better at kind of embracing those innovations and saying, great, we can scale up, we'll help you take off. And that's so depressing when you think of the wasted opportunities and the missed potential, and actually the enormous amount of money that the UK spends in terms of our R&D, including taxpayers' money. But we just let so much of the return on that investment slip through our fingers. It's crazy, and there's no good reason for it.
Thanks for that. And you mentioned earlier you put about 1.1 billion into the system to fund some of these ideas. But the problem that we have at the moment is that we treat sick care, as you mentioned in your keynote, but we need to go more to prevention.
Yeah.
So how do you repurpose the funding? So we know the fact is 90% of the work done in the NHS is by primary care, but 90% of the funding is into secondary care. How do we change that whole model around funding and bringing more patients to well-being, maintain their chronic health? And maintaining at home.
So, I mean, over a decade, we want to shift the centre of gravity, as I sort of described, out of NHS into primary and community services, out of hospitals into primary community services. The second big shift is obviously from analogue to digital, and I majored on that in my speech. But the third shift is from sickness to prevention. About 80% of what determines our health and our healthy life expectancy has bugger all to do with the NHS and the Department of Health. It's our diet and nutrition, access to physical education and arts and culture and all the things that make life worth living, housing quality. Think of those kids in temporary accommodation and bedsits with mould, causing respiratory infections at the kind of sharp end, extreme end of the situation. Our employment conditions, whether we have good work, whether we're feeling fulfilled in terms of our life. And that's where I think the sort of the mission-driven approach that Keir set out is really quite exciting and has the potential to be radical and transformational in terms of how government works. Because he's set some very ambitious goals for the next Labour government that require us to pull together every arm of government in pursuit of promoting good health and preventing ill health and tackling health inequalities in our society. That cross-government working is fiendishly difficult to do and only possible with leadership from the Prime Minister. And even more radically, he recognises that we're serious about this. Government can't do everything. We've got to partner with our private sector. We've got to partner with our voluntary and community sector. And we've got to empower individual citizens to take more control over our own lives, our own health and our own well-being. And if we can bring that together, then the sky is the limit. But that requires a completely different way of doing government. It's why that has to be led by the Prime Minister, and why, despite all of the regular nonsense you read from the commentariat saying, oh, well, he came to politics late, oh, I'm not sure he's a very good politician. I mean, I just kind of point to where Labour was in 2019 and where we are today. I think he's pretty good at politics, actually. There's something quite interesting about Keir as someone who has come from outside politics and who, as Director of Public Prosecutions, saw on his desk on a daily basis the consequences of not getting there in time in terms of perpetrators and victims of crime. And of course, that principle of prevention applies very obviously to health, which is why we say prevention is better than cure. And it's why I think that when it comes to talking about a different way of doing government and a mission-driven government, not only is that exciting potential, I think we finally got someone in politics who's the real deal and will provide the central leadership in number 10 necessary to bring about that kind of change to the way we do our politics. And I tell you, if we can, over the course of a decade, if we can sort out our economy, sort out our National Health Service, and sort out the chronic, endemic lack of trust in politics and government, we wouldn't have done half bad, would we?
Absolutely not. Sadly, I think running out of time. Thank you so much, Wes, for discussion. We could spend hours here speaking about the future.
Yeah, we
of
could.
healthcare.
But thank you very much for having me along. And I wasn't joking when I said I'm really excited to hear what comes out of today, because I think the way that Wired brings you all together and provides this platform is brilliant, and we're watching and listening. So keep the conversation going and look forward to hearing about the success that comes out of today.
Thank you, Wes.
Thank you. Thank you very much.